Hi, everyone. Welcome to Fridays with Friends. I'm Margaret Kosick, Senior Attorney with Coast to Coast Legal Aid of South Florida. I'm here today with Director of Programs, Fernanda Kuchkarian of Health Foundation of South Florida. Welcome, Fernanda. We're very excited to have you here today and to announce our new partnership on the Healthcare Access Legal Project, or HELP.
Thank you so much, Margaret. It's such a pleasure and an honor to be here. This has been a much anticipated moment, so I'm very happy to be part of the announcement. Thank you.
So can you tell me more about the Health Foundation of South Florida and what your mission is?
Sure. So Health Foundation of South Florida, we are the largest funder in the region here of South Florida dedicated to health. We've been around for over 25 years, and we have really one main goal, and that's to make sure that every South Floridian has the opportunity to achieve optimal health and well-being. And we're not going to stop until that goal has been achieved because we know that there's significant disparities in the community. I mean, COVID just exacerbated these disparities. And our mission is to not only invest, through our grant making, but also be a catalyst for collaborations and systems and policy change with a focus on vulnerable populations, in particular low income communities. And we do this through three main goals. The first one, and they're all interrelated. The first goal is really increasing access to care, because we know that when people have access to quality primary care and preventative health services, it prevents them from developing more serious complications down the road or ending up in the emergency room as their usual source of care. The second goal is we're really thinking beyond healthcare into really the social determinants or those social needs that are the non-clinical needs that impact your health way more than your even genetic code or your access to clinical care. So for example, where you live, where you work, where you play, all these things play a role into your health. So how do we help health systems address things like safe and stable housing, access to healthy foods, transportation? So all these things play a huge role in whether or not you have not only access to care, but how healthy you are. And then the third goal is really something that the foundation is just now stepping into and thinking more broadly about health. And it's really at that intersection of community development and the social and economic factors that can contribute to how healthy a community is. So we're looking at things like housing and an inclusive economy, working with our key anchor institutions, which are our hospitals, our universities, to come up with solutions together. So that's what we mean that we are a catalyst for these collaborations, because we know that when we all work together and across systems, we can have a greater impact to the community.
Wow, that's incredible. As you know, the HELP project was created to provide free legal services to low-income, uninsured, or underinsured residents of Broward County related to the Affordable Care Act and the health insurance marketplace. So how do you think the HELP project aligns with that mission that you just described?
Well, first of all, I'm super proud to say that this is the first time that we are funding Coast to Coast Legal Aid. It's been such an honor to get to know your organization and the tremendous work that you do in the community. And, when we were really envisioning our access to care goal, we know that health insurance is a key entry point into the healthcare system. And unfortunately, despite all the advances with the Affordable Care Act, South Florida still has a very high uninsured rate, and that's particularly true among Blacks and Hispanics. So as we were designing our vision around how to increase health insurance coverage, and particularly for low income communities, we really wanted to think holistically and not only fund those direct service providers that are doing the outreach and enrollment efforts on the ground, which we have done. We have brought together a cohort of partners, but we also wanted to look beyond that, because we know that just getting enrolled is also just one more step, but it's not the entire, people may not access their insurance or may have trouble with their eligibility or even be denied services. So we know that incorporating a legal expert, such as with Coast to Coast, we can address some of those additional barriers that just signing up for insurance won't address. So we really saw legal aid, and in particular, because we are also we have medical legal partnerships that we have funded in the past, both in Broward and Miami-Dade, and we have seen such a tremendous impact of when you have a legal, an attorney as part of the healthcare team to address those social needs that I was talking about earlier. So it just made sense. It made sense to bring your expertise, which is a very unique service, not only to help clients who have issues, but also to help educate the enrollment assisters and the navigators who are on the ground, helping people enroll into a plan.
Thank you so much. Yeah, we're really excited to begin working on this. And can you tell me more about the other organizations that you're working with on healthcare access? And can you explain your projects with them?
Sure. So in the fall of last year, we funded 4 organizations that have been doing outreach and enrollment for many years. They really are the experts. And we wanted to bring a mix of, community-based organizations with grassroots organizations, as well as testing a new nonprofit broker model, because we see all 3 of them having value in the way they approach doing targeted outreach to communities who are uninsured and are hard to reach. So we really wanted to build around this network of diverse and coordinated consumer assistance programs, because we know the literature shows that when somebody has help, they're more likely to enroll into a plan than doing it on their own. So really building around this network of enrollment assisters, phase 2, which is how we funded Coast to Coast, is bringing in those additional resources. So legal services, as well as looking at the broader policy and advocacy groups that are doing work at a higher level to bring change, because we know that we can fund direct service programs all day long, but if we don't start addressing some of the key barriers through policy, we won't get that impact that we desire. So we're also funding a Florida Health Justice Project, which is they're looking at, we know Medicaid, the public health emergency, the unwind is going to come sooner than later. And everyone that is currently enjoying having Medicaid, even though they may no longer be eligible, once they lose their coverage, it's going to be, really difficult to make sure that they don't fall through the cracks. So they're looking at things from a systems level, and there will be also part of the cohort or funded grantees to look at these things together, because one of the things that they would like to see is helping then those persons that lose their Medicaid be connected to the marketplace and have that assistance to make sure that they're aware of the subsidies that they may be eligible for, that they wouldn't have been otherwise. So we really wanted to do this. It's a 3-year initiative. It just got kicked off. We really hope that being that multi-year long-term funder, that we give organizations such as yourselves a chance to think through any barriers or obstacles or come up with new ways of working together. Because again, we want to be that multiple impact multiplier to really work together to solve, the high uninsured rate in South Florida.
Right. Yeah. I mean, healthcare can be extremely complicated and difficult for people to work their way through, or they don't always understand. Like you said, when they lose their Medicaid, they're not going to be told right away, well, hey, you're eligible for marketplace subsidies. Why don't you go over there? So it's really important that they're advised on their eligibility. And so thank you again so much for working with us on this. I can't wait to get started on it. And was there anything else you wanted to add or mention before we go?
No, I mean, like you said, healthcare is complicated. I personally, just went through something with my son going to the hospital, and now we're getting the bills. And, I consider myself to have, the resources and the, health insurance literacy, but even I can't, navigate some of the challenges. So imagine, South Florida has a large immigrant population where English may not be their first language. So really providing that one-on-one assistance, I think, will make all the difference. So really, I'm the one who thanks you for the work that you do. And I'm just really looking forward to our ongoing collaboration.
So for everyone, the HELP project is starting June 1st. Anyone who's interested in getting legal advice or assistance with health insurance marketplace eligibility, coverage, or services, please contact our paralegal, Manuela Felix, at 954-786-8255. 736-2490. Thank you so much for joining us, and thank you again, Fernanda.
Thank you.
Be sure to check out Fridays with Friends in the future and follow us on social media.